there are a lot of bands and a lot of noise outside. So I hope you can hear me properly. If you can't hear me properly, just write a note so that I can speak a bit louder. It is Ganesh festival celebration, and everywhere there are bands and music and everything is going on. So let us today see something in relation to a case, and then I'll discuss something in relation to Mater Medica. Now a lot of queries come to me that, sir, teach us some Mater Medica, teach us some remedy. See, teaching a remedy is very easy because I can easily get to a remedy and teach you how to use the remedy. My intention in this YouTube live or this YouTube live is that every time you have to learn something more clinical. Clinical means whatever I have seen in my practice, whatever results I have got in my practice, and how I have applied that remedy using the patient's language and converting them into a rubric form. For example, there are a lot of cases in your practice. The patient comes that, Doctor Sahab, now what I can do? Just I can do nothing. I can't go here, I can't go there. I can't study because I have not got good marks. I literally feel helpless. And immediately in homeopathy, we have a beautiful rubric called as a feeling of helplessness. Very easy to understand in a grand way what is the meaning of helplessness. If you go in the dictionary, it is very easy to understand helplessness. But there are remedies in that. For example, we have medorinum, gelsemium, lycopodium, caladium, what you call hydrogen, sepia. There is a feeling of helplessness in all these remedies. Now, knowing these remedies in relation to helplessness is very, very important. Otherwise, you open Mater Medica and lycopodium, you have the same symptoms: 4 to 8 aggravation, red sand in urine, child cries before urination, the patient is hot, the patient is thirstless, aggravation 4 to 8 pm, bloating of the abdomen, distension of the abdomen. It is there. It will always be there. But what are the symptoms of drug lycopodium or gelsemium or medorinum in relation to helplessness? Why does that patient feels helpless, and then the symptom starts, and then we can think about the remedy. For example, if you take gelsemium, now gelsemium is a remedy which has very, very classical symptoms. For example, heaviness of the eyelids, cannot open the eyelid, ptosis of eyelid, muscles refuse to obey the will. There are a lot of symptoms of gelsemium. But what will you do where the if you think about the rubric gelsemium, the rubric helplessness? So let us see and understand gelsemium, how the patient will behave with this symptom. For example, you never think about gelsemium when there is grief, especially quiet disposition in grief. When a gelsemium patient feels helpless, he in grief or whatever condition, it is said that there is a very quiet disposition of gelsemium in grief. Hello, are you with me? So quiet disposition in grief, that is the first entry point of gelsemium. When the patient feels a lot of grief, when the patient feels a lot of stress, make the patient understand why you're asking that symptom. That is very important. Second, it is said that a gelsemium patient, when he feels helpless, there is a lot of sadness. Now you have to define the sadness of gelsemium. Sadness, especially in summer, because gelsemium is aggravation in summer. But sadness is also very, very important. In fact, whenever there is sadness and you try to cajole the patient, you try to motivate the patient, you try to stimulate, you try to make the patient happier in a comfort zone, gelsemium will not come in that. Gelsemium has sadness or lassitude. Even stimulants do not emulate. Now stimulants, you can say tea, coffee, or mental stimulant also, that motivation does not relieve the sadness of gelsemium when you feel helpless. Are you with me, everybody? See, if you talk to me, if you give some inputs, I'll be able to make you, you know, feel the remedy better. I should know what whether I am teaching is normal or you're understanding that. So the exactly opposite symptom of gelsemium sadness is the patient has there is one kind of patient, there is a lot of weeping, and there is so much weeping. The main thing is the patient will weep until you do not talk to the patient constantly. You stop talking, the patient starts sweeping. So there are both the phase of helplessness in gelsemium. One is the sadness, one is the quiet disposition, and one is the feeling of weeping if the patient is not talked constantly. Or you can go one more step further, if the patient is not attended in that weeping phase. So these are the symptoms of helplessness. And direct symptoms of helplessness of gelsemium: feeling of helplessness from mental exertion, that is also gelsemium. Or you can say feeling of helplessness or feeling of weakness in mental exertion, that is also gelsemium. So this is how you have to understand the rubric and then prescribe. Or otherwise, if you take a general rubric helplessness, you take modalities, you take thermals, and if you prescribe, you may or you may not get the result. But if you understand the rubric why the patient is helpless in gelsemium, you'll be able to prescribe it better. Hello, are you with me? Today nobody has any questions, only I am talking. So if you understand helplessness, so for example, I will go one step further and tell you what is the helplessness feature of lycopodium. We'll again start from weeping. So weeping of gelsemium is that the patient will weep if the patient is not talked constantly. How is the weeping of lycopodium? If I ask you, why has the weeping of lycopodium? One answer is very very clear, and one answer is very very common in lycopodium. That is, everybody knows it: weeping when thanked. But in my practice, I have seen in lycopodium that is weeping about the future. This is very very important about lycopodium: weeping about the future. The patient has so much stress, the patient feels what will happen in my future, and that's how the lycopodium has weeping. What was the weeping of gelsemium? Bear that in mind. So this is weeping of lycopodium, this is weeping of gelsemium. We have weeping of meteoronum, we have weeping of caladium. That you have is a homework for you. As we go further, I'll try to compare the sadness also, the sadness of gelsemium and the sadness of lycopodium. Now in lycopodium, there is lot of sadness before eructations, my dear friends. Lot of sadness before eructations. Welcome, good afternoon, Dr. Vishaka. I was just telling you something about the rubric helplessness and trying to compare the remedies of helplessness in relation to lycopodium and relation to gelsemium. Gelsemium we have finished, lycopodium I am just going through. So sadness before eructation is a very very important symptom of lycopodium, because in stomach symptom there are a lot of symptoms of lycopodium, very difficult to differentiate from carbo-veg or China or other remedies. Second sadness symptom of lycopodium is sadness from distant music. Now this literal meaning you can take from distant music, that's okay. But if somebody is talking about lycopodium, somebody is not talking well about lycopodium, maybe not present here, present outside his friend circle, present out of what he is living, but still that will affect the lycopodium patient, and that makes the patient sad. So this is also a state of helplessness of lycopodium. I always keep telling you, rubrics we take, but what are the rubrics and how are the meaning of rubrics in that remedy? That symptom you have to understand. So this is the helplessness of lycopodium, the helplessness of gelsemium. Medorinum and calidum is a homework for you. So let us go forward. There was a question. Please share your experience with histamine in urticaria cases. Yes. So what happens normally, in allopathy, as I always say, it is very easy to practice. Though difficult to study, sometimes, but easy to practice. Histamine relief, give antihistaminic, and the patient is much better. But in homeopathy, very difficult. I have a lot of cases of urticaria. Some respond very well to the treatment and some have a problem because they don't get better also. Now, if you see histamine, suppose a lot of patient comes to us, and one variation of prescribing histamine is that, for example, I know the patient is bovista, I know the patient is epismel, the patient is better for some days, but again it reoccurs. In that case, I use histamine as an intercurrent remedy. I give histamine one dose, wait for 3-4 days, and then I give the indicated remedy. This is the first symptom I take. This is the first indication of histamine when the best selected remedy is not giving the result as we expected, and then if it is not working, then you must think about histamine. This is the first instance. Don't give histamine just because in allopathy we give antihistaminics. You give histamine 1 mg 3 times a day and the patient is not better. This is my experience. First thing. Second thing, in histamine, like Nux mosquita, there is a lot of dryness of the mouth. This dryness of the mouth is a very important symptom when I prescribe histamine as a constitutional medicine. Hello, are you with me? This is the second remedy. It is not intercurrent basically. Sometimes you can, if the remedy is not working, I give a push with histamine. Third symptom of histamine which I have seen in my practice is nausea on a thought of food. The patient just thinks that today I have to eat pav bhaji, and just by thinking of eating that pav bhaji, the patient starts getting nausea. These are the three indications which I give histamine in my practice. I never give histamine, my histamine ditaniyu, when I give histamine 3 times a day because nothing is working. I don't give histamine in that cases. This is the use of histamine which I use in my practice and I get good results. Though there are a lot of cases in my practice also where there is a lot of difficulty in treating urticaria which is chronic, or treating urticaria which is steroid dependent, or in treating urticaria where the patient has been taking antihistaminics for years but there is no change. I also get a lot of problems in these cases. Then I prescribe those medicines. Histamine I start, then in between I give histamine with the indicated remedy. This is how I treat my cases of urticaria. Okay, so let us go forward. Yeah, so let us go forward. Anybody, any other question? Thanks. Yeah, Dr. Vishaka, thank you. And if you treat or cure some case of histamine, do share with us so that we also know that the remedy is working. So I was telling you something about helplessness. Now there are, I'll just have one case where the patient, there is a very interesting rubric. There is a very interesting rubric where the patient says that if you tell me to do something, I'll not be able to do it. I feel very stressed. Okay, now what will happen, whether I'll be able to do it or not. What is this called as, and which remedy you must think of. These basically are the, these are basically the rubrics which I am teaching to my students, and they have they have come out with a fantastic answer to this. So whenever the patient says, whenever I have been told to do something, it is very difficult for me to do it. I cannot do it. There is a lot of anxiety. What is the rubric, and which remedy comes to you in my mind? Anybody? What is the rubric which I am talking about, and what remedy comes to your mind? There is a beautiful rubric in our repertory. Expected. Now we are telling that anxiety when the patient has been compelled to do something. Anxiety whenever the patient has been compelled to do something. And this is a very very important rubric. I just told to my assistant doctors, why? Because in today's world, in today's corporate world, there are a lot of targets. There are a lot of targets that you have to do. You have to complete this. You have to sell this. You have to. This is a quota. You expected to do. In that case, this rubric is very important. Anxiety to do something when compelled to do. Hello, are you with me? Anxiety to do something when compelled to do. You have to complete this work before 31st. You have to do this target of sales before 31st, and then the anxiety starts. Anxiety to do something when compelled to do. Are you with me? And there is a beautiful rubric, and there is a remedy called as Bryonia alba, and that is the only remedy in this rubric. Of course, don't always prescribe Bryonia. Try to club the rubric so that you can get a wide range of remedy when you prescribe that. But this is a very very important rubric which I have seen and basically given Bryonia, where you don't think of the remedy on anxiety, but still it is present in the repertory and single remedy in that rubric. Sir, kindly tell some medicine when one person have depression and he wants to do. This question of depression has been coming so often, Nitin. I just request you to visit a homeopathic doctor in your area, so that you are, you become very satisfied with the doctor, and he'll do the whole case taking. There are a lot of remedies, with drowsiness you can take of Nux moscato also. Yeah, good afternoon. Okay, so I hope you got this. For example, there was a beautiful case, where it was doctor, and he did not miss a single OPD in spite of his friends telling him to go and go for outing, come with them. He was adamant that if he goes out, the practice will suffer, the patient will go, how will I earn, my quota will not be completed. That was the symptom of that doctor. Of course, I took the whole case, I repertorized the case, I gave remedies, 3 or 4 remedies. It only worked partially. But there's a beautiful rubric in the repertory: anxiety about business, although prosperous. Means he had a beautiful running practice, very happy with the practice, but he still feels, what will happen if I don't sit every day? I'll have no money, the patient will run away, my business will suffer. So he never went outside. So this is basically the rubric called as anxiety about business, though prosperous. Again, in that rubric, only one remedy, and that is Soranum. Yes, very rightly said. Sir, my meaning was no desire to do any physical or mental work. I have told this a lot of times. If you don't have the repertory also, if you go to the Allen's keynote, the remedy natrum carb, introduction, first 2 lines. He is like a couch potato, nothing, wants to do nothing, neither physical work or mental work, just wants to relax, does not want to go out in open air also. There are a lot of remedies, but natrum carb have given me a lot of good results. Okay, so well said, Dr. Vishaka. That was Soranum only. So it is, see, sometimes very easy to understand the rubric, but very difficult sometimes when the patient is telling rubric or symptom in front of you, but you're not able to get the rubric. For example, a patient comes to you and tells you, Doctor, no, if somebody tells me come to the clinic, I have an appointment at 2 o'clock, I start getting anxiety. I cannot come. There's a lot of anxiety. At 11 o'clock also in the morning, I'll start getting ready because I have to come to a clinic at 2 o'clock. Or anything. If I have exams at 10 o'clock, I start getting anxiety. If I have to go for a festival at 4 o'clock, I start becoming panic and anxiety. Now, which is the rubric and which remedy comes to your mind? Anybody? This is what what I want to tell you. There are so many symptoms where the patient tells you, for that the rubrics are so close. Sometimes we have the remedy, we have the rubric in front of us, but there are so many rubrics for one condition. You get panicky, what rubric to take? Am I right or wrong? Is it that happens in my practice? With me also, sometimes patient is telling you beautiful symptoms, and we feel now which rubric to take. Yeah, anxiety trifles also one is the rubric. So there is difficulty which I face in my practice. That's why I'm discussing these rubrics. You can take your anxiety when time is set, yeah. And if you see the repertory, there is no arsenic in that. We have the remedy argentum nitricum or lycopodium also. But argentum nitricum, whenever you give, I have given with this rubric, I have never failed. So this is the importance of understanding, because otherwise, restlessness, we have two remedies in our mind, arsenic, rust tox. There are so many rubric related to restlessness. Like for example, anguish cannot sit in one place. What remedy comes to your mind? Anybody? Anguish cannot sit at one place. Which remedy comes to your mind? Very, very, interesting remedy. But if the patient comes and tells you that the patient cannot sit properly, there is a lot of stress, there's a lot of anguish, he cannot sit in front of you, you take the rubric restlessness and you miss that case. So this is a homework for you. There is so much anguish, there is so much pain, he cannot sit, he walks, then he lies down, then he is never at one place. Which is the remedy that comes to your mind? Anybody? Yes, anybody? What a beautiful symptom. Lot of anguish, lot of anxiety, but the patient cannot sit in one place, lies down, walks, sleeps, but cannot sit in one place. Now the main thing starts. This is a very easy symptom. We know this is restlessness. You go in the rubric restlessness and there are a lot of remedies, and you will never be able to prescribe this remedy which I am telling you. You will never be able to prescribe this remedy. There is, so Dr. Zenas says it is arsenic, it is rust tox. No, it is there. But hear me, anguish, he sits, then he walks, then he lies down. He is never in one place. Rust tox is right, arsenic is right. That's what I'm telling you. I get this difficulty when I'm taking symptom, now what rubric to take, what symptom to take. That's why I'm sharing this with you. I'll just take one question. Sir, kindly also tell some medicines for frozen shoulder together with it. You can take Calmia, you can take Spigelia, you can take Calcarea Flor, you can take Guaiacum, you can take, there are a lot of remedies. You can take Kali Carb, you can take rust tox, lot of remedies. But treat the basic cause. If frozen shoulders because of diabetes or some other problem, please suggest me about hyperacidity, burning sensation in stomach, mouth ulcers. The solution is homeopathy. And see, this is a very vague symptom. See, there are a lot of medicines for that. For example, you can think about Moxol, you can think about Borax, you can think about sulfur, you can think about carbamide, you can think about Iberis, you can think about Lycopodium, Calicarb, Argentum, Leptandra, China, a lot of remedies, So let us go forward. So what is the remedy which I am telling you? Lot of doctors online, you can always share. I also make a lot of mistakes in my practice. Taking rubrics, I also take a mistake. I do a lot of mistakes. But you have to learn every time. If you keep learning, because this remedy which I am going to tell you today, you will never be able to prescribe because it is not taught so frequently by in the class or in the school, in the college or in the seminars. Can we take Nux vomica? Yes, you can take Nux vomica also, Dr. Pandey. बिल्कुल लीजिए Nux vomica. But सबके symptoms अलग अलग रहते हैं. Nux vomica बिल्कुल ले सकते हैं. So which remedy I am talking about? Anybody? Yeah, belladonna is also there. Yes. Which remedy I am talking about? That you have to just tell me and we'll then move forward. The remedy which I am talking about is bismuth. The remedy I am talking about is bismuth or bismuth. You open your Allen's keynote, see bismuth. I think in the older version of Allen's keynote, it is the second or the third symptom. Anguish. He sits, he walks, he lies, never long in one place. No, it is bismuth, Dr. Vishaka. It is bismuth. Go and see bismuth in Allen's keynote, and you will be surprised that you have never thought about bismuth, but bismuth is there in that. I have so many cases, where I have given bismuth and it has given fantastic results. So this is the importance of understanding the rubrics. Rubrics. Sometimes the rubric is in front of you. but because you have been taught that rubric so many times, you always take that rubric and you forget the lesser known remedies which are there in the rubric. Okay, so if you have Allen's keynote, you can have that rubric. Of course, if you repetize that case, restlessness, if you see, there are so many, there may be about 500 medicines, but one of the medicine would be bismuth and it would be there in that. But have you ever prescribed bismuth in that? No, because it is not taught about, it is not thought about. That's why in repertory, make sure that when you are repetizing a case, you take a rubric properly indicated for that personality. Don't take one symptom and rubric. If you take one symptom and repetize every time the same medicine comes, Rustox, arsenic, and what Rustox, arsenic, and ferrum, hyoscyamus, cuprum, calcareous, calcareca, belladonna, these remedies would come. The rare remedies would not come. So let us go for any other questions. I think some questions have been scrolled up. If I have, I hope you're understanding. I hope you're understanding. Hello, are you with me? If you are with me, just give me some indication that you are. Otherwise, it's like talking with the computer. Sometimes. Okay, so I hope. Yeah. So I hope bismuth was very interesting for bismuth. That's why Allen's keynote. Whenever I'm teaching my doctors who are with me, they also sometimes feel, sir, we have never thought about this remedy. For example, yesterday we were talking about something in relation to a remedy where it was written that the child, the patient came and told, sir, my child, suddenly wakes up in the night. And there is no cause. I have shown to a pediatrician, the stomach is okay, the teething is okay, there is no pain, nothing, but suddenly wakes up in the night and starts screaming. And this becomes a very vague symptoms, But yesterday we were discussing with my fellow doctors who are working with me, and with that symptom, the patient had one more symptom, that his skin was very unhealthy. That whenever a diaper is put, whenever somebody takes him on the chest, and there's abrasion of the what you call nails, the skin becomes itching, and there's pustules and pus formation. These were the only two symptoms the patient came to us for treatment. And when I told to my fellow doctors who are working with me, they have joined me, and I prescribed the patient simple remedy, borax. If you open Allen's keynote, if you see borax, it is written child awakens suddenly without apparent cause. Of course, Cinna would be there for worms, epismel is there, but borax is also there. If you open Allen's keynote, borax, there's one symptom of skin, that skin is unhealthy. Slightest injury suppurates. Merxol is there, Heparsulf is there, Cilicia is there, every remedy, but borax is also there. If you see borax, it's a beautiful remedy, but we never think about borax because we are not taught borax for suppuration. But that child with borax had a beautiful result. He telephoned us and he's much better now. That is the importance of reading repertory, reading Mathematica, or reading anything. But keep reading. That is very important. Okay. Let us go forward. Sir, viral for case for CSF chronic fatigue syndrome. Take a whole history, Nitin. Sir, viral coryza where discharge, clear water turned yellow, and patient clogged sensation due to profuse discharge. Yeah. So see, coryza again, a very difficult thing to treat, because see your case is coryza, viral coryza, blocked nose. There are 3-4 remedies that comes to my mind: aurum triphyllum, arsenic, calibichrome, pulsatilla, cilicia. These are the 5 remedies you must think about. Okay, so let us go forward. Sir, loneliness का problem है with fear and anxiety. See, basically what happens that if you open your there is a cause of everything, doctor. If there is loneliness, alone feeling, there has to be a cause. But still, in your case, I'll give 3-4 remedies. First is arsenic album, second is phosphorus, third is calicarb, fourth is fluoric acid, and fifth is a very again rare remedy but a beautiful remedy, Drosera rotundifolia. Okay, so these are the remedies. I hope you understood today something about rubrics and something about borax and something about that remedy which is bismuth. So keep yourself posted with your reading Mathematics, not only every time repeat. Every day in the morning you get one rubric and you're very happy. Okay, I know the rubric. Knowing the rubric in the literal meaning and from the patient is different. That's what I teach to my students. Okay, it's already half an hour up, and thank you for joining. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye and thank you.